Chapter 29 is Hematologic System Introduction. Structures and components of the hematologic systems. You have the bone marrow, kidneys, liver, spleen, and then the blood itself. For blood, you have RBCs, which is your red blood cells or erythrocytes, platelets, or sometimes we call it thrombocytes, the clotting factors, and then the plasma, which is the fluid part of the blood. Okay, bone marrow. So this is the spongy center of the bones. Red blood cells and platelets are being produced and made in the bone marrow. Majority of RBCs, they are produced in the vertebrae, in the ribs, in the sternum, skull, pelvis, and the long bones of the legs. Kidneys. These manufacture the hormone we call hematopoietin, and hematopoietin is the one that's actually stimulating the production of red blood cells in the bone marrow. So this hormone is being released in response to hypoxia. Then you have the liver, which manufactures clotting factors and is also responsible for clearing old and damaged red blood cells from the circulation. Spleen is helping to clear old and damaged red blood cells from the circulation. Blood, it contains the RBC, red blood cells, the platelets, clotting factors, plasma, some white blood cells, proteins, electrolytes, hormones, and enzymes. This is the one that's responsible for transporting oxygen. So the red blood cell, there's a hemoglobin in the red blood cell that is actually the one that is transporting oxygen from the lungs to the tissues and then transports the carbon dioxide from the tissues to the lungs out from the body. RBCs is a disc shaped. It is biconcave and the lifespan is 120 days. And then you have the blood antigens, right? That is actually responsible for like blood typing, and the rhesus, which is actually the one that is responsible for if we are like positive or negative, like for example B plus or B negative. Platelet is the one that's responsible for blood clotting. This activates the blood clotting system. It is the one that goes into a break in a blood vessel. So if there's like an injury in the blood vessels, platelet is the one that goes to the area and it starts that cascade of blood clotting and by forming a platelet plug. And the normal lifespan of platelet is only 10 days. Clotting factors, so we have factors 1 through 8. This is helping the platelet when there's a break or injury and there's a bleeding. This one helps with the platelet with the clotting cascade. What the clotting factors does is it forms a stable fibrin matrix over the wounded area and it protects the injured site while the healing process is being completed. Plasma is the clear straw-colored fluid that carries the red blood cells, platelets, and the clotting factors, and this is primarily water. It's the fluid part of the blood. Okay, physiologic functions of the hematologic system, oxygenation and hemostasis. All right, so we did talk about the RBCs containing those oxygen and the one that is actually um, taking the carbon dioxide from the tissues to the lungs and out of the body. That is one function of the hematologic system. You know, those blood is the one that is flowing through all throughout the body, carrying that oxygen all throughout the body, making sure that the organs and the tissues are oxygenated, so it doesn't die. Hemostasis, let's see page 530. Figure 29.2. So this is how a blood clot is being formed, formation of blood clot. There's a sequence of events that happen. Well, so of course, first step is there's going to be an injury to the blood vessels, right? Injury to the blood vessels. And then the first thing that the vessel is trying to do is to constrict, right? Because it's trying to decrease that bleeding as much as it can. So it's going to constrict that vessel, and then the platelet is the one that again is going to go to that area. Platelet will be released by the platelet factors. And then next step is that there's going to be a lot of things that's going to go over there. Platelet factors attract more platelets, and then now the clotting factor is the one that's going to be activated, like your prothrombin activator is going to be formed. And then what's going to happen is your prothrombin is going to be converted to thrombin, okay? And then your thrombin is going to be the one that's actually helping the fibrinogen to convert to fibrin, and then that fibrin is the one that actually threads, and it looks like a tangle. It looks like a tangle with platelets, and then it traps more red blood cells. And what it does is it's like trying to form that web, or trying to form that clot so that it stops the bleeding. All right, next stage is that the plasminogen is going to be converted to plasmin. Once the plasmin is converted, it breaks the clot into fibrin split products, and the body will now start to dissolve it. Okay, this is the sequence of events for formation of blood clot. This is how the body is actually trying to stop bleeding. Nursing assessment of the hematologic system. We need to make sure that we're checking both health history and physical examination of the patient. Um, First, we're going to check what is the reason for the patient to be seeking care, what is the present health status of the patient, past health history, family history, and then you're going to do the review of systems and then functional assessment. And then physical examination, you're going to check the general survey of the patient. Is the patient actually actively bleeding, right? Is there like skin abnormalities like your PTKA or like bruising, those things. Like you're gonna do a general survey, and then you're gonna do a skin survey, head to toe assessment, to see if there's like anything or any indications that could tell you that there's a problem with the hematologic system. Okay. Like we said, general survey. So you're gonna start with the vital signs, the height and the weight, and then you're gonna check for orthostatic changes. Okay. So what is orthostatic changes? Let's go to that page 533, box 23.9. So this is how we assess for orthostatic changes in vital signs. You're gonna have the patient lie down on a bed or in a reclining chair for at least 1 minute. And then you're gonna record the patient's heart rate and then the blood pressure. And then you're gonna ask the patient to sit up. After the patient has been sitting up for no more than like 30 seconds, you record the heart rate and then the blood pressure again. Then you're going to have the patient to stand up. After the patient has been standing up for no more than 30 seconds, you're going to record the heart rate and then the blood pressure again. And this is the thing that we need to remember. If the blood pressure decreases 10 to 15 points with the change from the lying to the standing position, and then the heart rate increases 10 to 15 points from lying to standing, the patient is described as having orthostatic hypotension or tilt positive changes. Okay. Um, and then going back to this one, so you're gonna continue and doing your to do your general survey. You're gonna check for the mood, the expression, the posture of the patient, and is there any swelling areas. Skin, like I said earlier, the skin is a good indicator if there's like any blood problems or hematologic problems. You're gonna check if the skin is pale, is it jaundice or yellow, is it dry, itchy skin, and the scalp and brittle fingernails and toenails, which is an indication of a vitamin deficiency. And then you check for petechiae, purpura, and ecchymosis. Ecchymosis is bruise. So here, this is your petechiae, and then the purpura, and then the ecchymosis. Petechiae are small, red or reddish purple pinpoint spots on the skin, and this one results from blood capillaries breaking and leaking small amounts of blood into the tissues. Purpura is the one on the right side, and this is a result of this is red or reddish purple spots and are the results of a larger blood vessels breaking. Purpura are larger than the petechiae, as you can see. And then ecchymosis, by the way, purpura can suggest a low platelet count or a problem with clotting factors in the blood. And then you have the ecchymosis. Ecchymosis is a bruise. This is a larger purplish area of the skin. This results from a larger amount of blood that is leaking outside of the blood vessels. Very important to remember that ecchymosis or bruising does not necessarily indicate a bleeding disorder. Because, anybody can have bruise. Like, for example, um, a person that don't have a problem with blood clotting disorder or hematologic disorder can like bump into something and then starts bruising, because that's just a leak of that blood from the blood vessels into the tissues. But if you know that your patient is actually having that constant ecchymosis or constant bruising, then that is the red flag, and that could indicate a bleeding disorder. If they actually bruises very easily than a normal person, then that could also be an indication also of a blood disorder. And then we're checking the head and the neck. We're going to evaluate ear, nose, mouth, and the throat, checking for the corners of the mouth, cracking at the corners of the mouth, which is actually an indicator of vitamin B deficiency. And then we're going to check the chest, which is the thorax. You're going to check the respiratory rate, the effort, breath sounds, and is the patient having some shortness of breath or what we call dyspnea, because these things, this shortness of breath can actually be an indicator for low red blood cells. Then you're gonna do and check the abdomen. You're gonna check for distension and tenderness, because if you have a tender abdomen, then there might be an internal bleeding that's going on in the abdomen. Organ enlargement, you're gonna check for the liver enlargement. We talked about the liver and the function of the liver with the blood clotting factor. So if there's like an organ enlargement, there's a liver enlargement, then there might be something wrong with the blood clotting or hematologic system. Stool sample, which is what we call occult blood, okay, or guaiac test. So occult, it means hidden. Okay, occult means hidden. So we do this as nurses if we think that there's like some kind of bleeding internally, and we're trying to rule that out. what we do is we collect a sample of the stool, and then we send it to the lab, and we order what we call, or we get an order from the doctor for what we call an occult blood. So the lab will tell us if it's positive for the occult blood or is it negative for the occult blood. Obviously, if it's positive for the occult blood, then there's some bleeding that's going on inside. And then same thing with the urine sample is we're going to collect the urine sample, and then we're going to send it to the lab, and then the lab will tell us if there's like a presence of blood. And again, positive result will tell us that there's some bleeding that's going on inside. Okay, diagnostic tests and procedure for hematologic system. So we're gonna have some blood tests, and then we may even need to do some biopsy. For blood tests, let's go to page 534, table 29.1. So this is talking about the normal values for the blood count. So it's important to highlight these things and remember them for exams. So red blood cell, let's look at red blood cell or the RBC count. The normal for adult male is 4.7 to 6.1 million per cubic millimeter, and then for female is 4.2 to 5.4 million per cubic millimeter. So what's the significance of this value? If it's low, then it might indicate anemia, hemorrhage, hemolysis, iron or vitamin B12 deficiency, genetic variations, bone marrow failure, renal disease, and some drugs that could actually cause a low RBC. And then high is dehydration, and then some drugs that could actually cause RBC, high RBC. Okay, hemoglobin and hematocrit. Please highlight these things too and remember them, the numbers. So hemoglobin, the adult male is 14 to 8 or 8.7 to 11.2. And then for adult female is 12 to 16. For older adult, there will be a slight decrease and it's normal for them. Significant values, if it's low, then there will be anemia, delusional, overhydration, some blood disorders, and some drugs. And then high is dehydration, high altitude, heavy smoking, and some drugs. For hematocrit, adult male, the normal is 42 to 52%. Adult female is 37 to 47%. And then for older adult, there will be a slight decrease. Significance of values is variation, same as RBC count that is mentioned earlier right there on top. So if it's low and it's high, then that's what the values means. Okay, and then let's go down to the white blood cell WBC count and differential. So you have your neutrophil, lymphocytes, the monocytes, eosinophils, and then the basophils. So for the white blood cell itself, if it's low, then it might be an indication for bone marrow failure. If it's high, obviously infection, right? Inflammation, leukemia, neoplasia. And then for the neutrophil, lymphocytes, monocytes, eosinophils, and basophils. So we just monitor them if they are high, because if they are high, then it is an indicator of certain things. Like for example, your neutrophil, if it's high, this is an indicator for acute bacterial infection and trauma. Lymphocytes is actually for chronic bacterial infection or acute viral infection. Monocytes is for monocytic leukemia, and then eosinophils and the basophils is for allergic and parasitic infection. Okay, and then your coagulation measures, which is your clotting measures. So you have the prothrombin time, which is the PT, and then the PTT, partial thromboplastin time. So what is the difference? Prothrombin time, or PT, this is, or PT and INR, sorry, this is the time to clot, okay? The time that the blood is actually clotting. So the lower the INR is, then that could indicate like increased risk for bleeding. And then the higher the INR is, there's an increase for clotting. Okay, normal function is 11.0 to 12.5 seconds, and then short and prolonged, you're gonna check what is the significance of these values. For short, the patient might be on a diet high in fat or leafy vegetables, which is actually affecting the PTINR, or the clotting time of the blood. And then for prolonged, it probably is a liver disease, or the use of oral anticoagulant therapy like urcumidine, biliary obstruction, and some drugs. Also, one thing to remember for your PT, prothrombin time, is this is the blood draw that we actually order for patients that are on Coumadin. Okay, Coumadin, or your warfarin is other name. This is the blood um, draw that we order for patient that is on Coumadin. PT, INR. Okay. All right. PTT is your partial thromboplastin time. This is the bleeding time. Okay, bleeding time, if you can write it down there. But highlight it. The normal PTT is 60 to 70 seconds and should not exceed 100 seconds. Um, if the patient is on anticoagulant therapy, what you want is a 1.5 to 2.5 times the control value in seconds. So this one, PTT, is the blood draw that we order for patients that are on heparin. Okay, heparin. All right. And then we do platelet count, which is just basically checking if there's an sufficient platelets. All adults, the normal value is 150,000 to 400,000. And what are the reasons or significant values? If it's low, there might be a bone marrow failure, hemorrhage, platelet destruction by drugs, infection, antibodies, and the condition DIC. And then high is estrogens and oral contraceptives, and high altitude. So bone marrow biopsy in page 536, 536 or 535, the table 29.2. So when we are actually trying to rule out some alterations in the function of the bone marrow, so we might need to do a bone marrow biopsy and check if it's working properly, or there's something that's going on there. So bone marrow biopsy tells us how well the bone marrow is making the red blood cell, the white blood cell, and the platelets. How do we prepare the patient? Very important for us nurses to understand. Patient preparation during a bone marrow biopsy. You explain the purpose and procedure to the patient. A permit must be signed. No fasting is necessary. And then you are going to actually tell the patient that they may experience some kind of discomfort because of the pressure that they're going to feel when the needle is actually inserted. There will be a momentary sharp pain down the leg. Okay, there will be a momentary sharp pain. And the procedure takes approximately 30 minutes. Okay, post-procedure, very, very important for us to highlight. Post-procedure nursing care, check the puncture site for bleeding. The pressure dressing can be removed in 2 hours, meaning it needs to stay there after the procedure and up to 2 hours. And then bed rest may be ordered for 30 to 60 minutes after the procedure. And then you make sure that you instruct the patient to report tenderness and or redness at the puncture site. So if you go to page 536, you're going to check to see in there, that's the common site of a bone marrow biopsy. That needle right there in the right side of the picture is the one that's going to be pushed in, and that's when the patient is going to feel that pressure and going to feel that momentarily sharp pain, is when the needle gets in, and then while it's aspirating that specimen. And then because of the site, then it's very important for us to actually make sure that we monitor for bleeding after the procedure. Okay, blood transfusion reactions. So we have hemolytic, anaphylactic, febrile, circulatory overload, and delayed hemolytic reactions. Let's go to page 539. Sorry, that's not page 239. It's actually page 539, table 29.4. This is actually where it's explaining like the types of blood transfusion reaction and what are the symptoms and how early it occurs, the signs and symptoms, and then how do we treat it and correct it. Okay, let's go over it one at a time. Hemolytic is going to have the symptoms of fever, chills, nausea, dyspnea, chest pain, back pain, hypotension, and blood in the urine. This occurs shortly after starting the transfusion. How do we correct this? You stop the transfusion. And by the way, what is causing this hemolytic is that there's an antigen antibody reaction to the transfusion itself, and what it's doing is it's actually destroying those RBCs or those blood because of the incompatibility of the blood. So not stop the transfusion, and then you notify the physician immediately, and then be prepared to provide supportive therapy to maintain heart rate and blood pressure. Anaphylactic is allergic reaction, type 1 hypersensitivity reaction to the plasma proteins. So symptoms for this is urticaria, and then wheezing, dyspnea, and hypotension. This occurs within 30 minutes of starting the transfusion. And what do? We stop the transfusion immediately. We notify the physician, and then be prepared also to administer those antihistamines, your epinephrine shot, and then the steroids. Febrile is when the recipient's antibodies react to the donor's white blood cell. The symptoms is fever and chills, and it occurs within 30 to 90 minutes of starting the transfusion. Again, we stop the transfusion and notify the physician immediately. Circulatory overload is when the patient's cardiovascular system is unable to manage the additional fluid load, so it's becoming a little, overwhelm or overload. Symptoms will be cough, and then there will be frothy sputum, cyanosis, and then decreased blood pressure. This occurs anytime during the transfusion and up to the several hours afterward. What do? We stop the transfusion, we call for help, be prepared to administer oxygen, and then diuretics. And then you have delayed hemolytic reaction. This one occurs in patients that's previously treated with RBC transfusion and alloimmunized, so that patient's own immune system attacks the transfused red blood cells. What are symptoms? Unexplained fever, unexplained decrease in hemoglobin and hematocrit, and it occurs 2 to 14 days after the transfusion. And the treatment is most delayed reaction, so it requires no treatment. So going back to this slide, I bolded it. We need to remember it. Stop the transfusion is always your first step. Do something about it. If you see that there's a blood transfusion reaction, stop the transfusion immediately and notify the physician. Okay, common therapeutic measures, nursing actions for the patient at risk for injury from low red blood cell count. Please go to page 536, box 29.4. You can read through this and highlight them and remember them. These are the nursing actions for patient with risk for injury because of the low red blood cell count or the anemia. Okay. Nursing action for the patient at risk for injury for bleeding. Please go to page 537, box 29.5. These are also interventions that we can do for patient that is at risk for bleeding. So highlight them, and then I think I just want to point out number 5 and number 6. So instruct the patient to use a soft bristled toothbrush. If oral bleeding occurs, then toothpads or mouth rinses can be used to maintain oral hygiene. And then for number 6, instruct the patient to use an electric razor to shave, not a straight edged razor. Okay. All right. Blood product transfusions is table 29.3. You can also read through this and then highlight things. And then colony stimulating factors, we talked about the hematopoietin earlier, but there's also some hormones that stimulate to produce more blood cells, and these are the medications or hormones that is helping with that. So your erythropoietin or your epogen is helping to stimulate the bone epogen, and the darbepoetin or RNFs. These medications are helping to stimulate the bone marrow to produce more red blood cells. And then your oprilvecin or Numega, this one is stimulates the bone marrow to produce more platelets. Okay. Just a repetition for the erythropoietin and then the RNS and the Numega. And then we have vitamin B12 and the iron or the ferrous sulfate that could actually help with anemia. Side effects for your iron is constipation, black stools, and heartburn. So these are the things that you want to educate your patient for when they're taking the iron, so they don't freak out when they see these things. Like, for example, black stools. They might think that it's like a sign of bleeding, but if you educate them and prepare them that yes, when you're taking iron or ferrous sulfate, one of the side effects could be black stools. Um, and then if the iron is actually liquid, you want to administer it through a straw to prevent staining the teeth. All right, question 1. After about blank days, the old red blood cells are filtered out of circulation by the liver and the spleen. And the answer is 120 days. And that concludes chapter 29, Hematologic System Introduction.